Hi, welcome. My name is Julie Yerkes, and I'm the Community Engagement Lead for the Partnership at Drug Free New Hampshire. Thanks for joining us today for Facebook Live, where we explore current prevention initiatives around the state of New Hampshire. This week the partnership is celebrating National Prevention Week, which is the theme of celebrating the possibility, what's possible. So National Prevention Week is a public education platform that is showcasing the work of communities and organizations around the country that are preventing substance use and promoting positive mental health. It is a SAMHSA initiative, and they say that in the past, Prevention Week would have a theme every single day, and it kind of would delve into that theme. But they've really recognized that prevention happens every day, not just during this second week of May, right? So this isn't the 1 week a year that we talk about prevention topics, right? It happens every day. And so they really started shifting to celebrate and promote those efforts that we're all doing year round. So you can see prevention initiatives that they're celebrating year round, which is what we do at the partnership. We bring in our partners from around the state and try to highlight them through these Facebook Lives, through our partnership convenings. And this is just a special week where we do it every single day. So we're thrilled to have Lisa Vasquez and Leah Elliot here today to kick us off on National Prevention Week with the Partnership at Drug Free New Hampshire. Lisa and Leah are both behavioral health specialists with the City of Nashua Health Department. They are both certified prevention specialists, and they are here today to tell us a little bit about what prevention means to them and what it looks like in Nashua. So thank you both so much for being here. I appreciate it. Leah just got back from a little vacation, and this is the first thing she's popping into after her catching up on email, I bet. So could you guys share with me how you became involved, how you got involved in prevention?
I can go first. So thank you, Julie, for having me. This is a great way to welcome myself back in. I love to talk about prevention. I love to talk about behavioral health. So this is a great segue back into the real world. I had some self-care this last week, and so really looking at coming back to 100% capacity to make sure that we're continuing to do the amazing work that we're doing here in Nashua. I, always knew I wanted to be involved with social justice. I think from a young age, I kind of grew up a little political and paying attention, and my family had always steered me towards law school. And, one day I said, well, instead of helping people after they get in trouble, maybe it'd be more helpful to help people before they get in trouble. So I think that is when I first had that prevention mindset. And, I'm a child of the 80s. We didn't talk about mental health back then. And as I became in the field and studying social work, it helped me to recognize my own behavioral health concerns and recognizing, that because it had been unaddressed, how that impacted some choices and decisions that I made in my life that still impact me now, 25 years later. And so I look at prevention and wanting to make sure that we're talking about these conversations, that people know that it is okay to have the conversations. It's okay to have mental health struggles, substance misuse struggles. And the more we can reduce the stigma, the more people are going to be more likely to talk about it so that they can get the help that they need. Prevention, we brush our teeth every day to prevent cavities. And so I think just trying to have the mindset of doing something every day to prevent a mental health or a substance misuse crisis.
Thank you, Leah. How about Lisa?
So, at first I thought, oh, I've only done prevention like once I started this job. But then thinking back, I think I've always been working in prevention. So it started with just making stuff up to have my cousins be entertained and ward off boredom. And then it grew to like people in my neighborhood, then people in my church, then doing weekend retreats, and kind of really made me feel like I was contributing to helping kids stay off the street, prevention for gangs, prevention for teen pregnancy. That's like what I focused on as a teen. And then when I moved here to Nashua, kind of figuring out, hey, where do I fit in here? And then finding this job was like perfect because it really made me feel like continuing that work, even though I didn't call it prevention,
Right.
back then. I do see it as a lifelong career of mine.
All right, great, thank you. And so you're both at Nashua Public Health Department now. So tell us what your current approach, to prevention is, and what that looks like in Nashua. Leah, do you want to start again?
Sure. I think that Nashua has shown and demonstrated their innovative approach to what we call wicked problems. If we go all the way back to 2016 of when we had the opioid crisis, and I wasn't a favor at public health at that point, but Lisa was, and really steering a whole project with the harm reduction program that we have now that I'll let Lisa talk about a little bit more. And then most recently, what we've been involved in is a partnership with the Nashua Police Department. So when we think about prevention, we know that police may be having involvement when someone is in a crisis, and talk about the very first time. And if we could prevent, that situation from escalating to the point that a person might need a higher level intervention, then I think that, being able to prevent that is key. And so one of the things that we did is worked with the police department to pilot a new partnership with the police department, a behavioral health co-responder. And so if a call comes into the police department that has to do with substance misuse, mental health, behavioral health, then we can help with that call to help, again, alleviate it, mediate it, so it doesn't rise to a higher level of care necessary, and then try to provide some resources in the moment, so that the person doesn't necessarily have to wait. So Lisa is amazing and can offer bilingual services. And so if we can be culturally adaptive. We also have community health workers in the building that speak different languages. So, we have that culture side as well to be able to address in the moment. And so I think, from the 2.5 years that I've been involved, I've seen a lot of innovative programming and just looking at what can we do. We've got people, we've got resources. How can we work together with other community partners to address some of, like I said, those wicked problems?
Is that what you call them in the office?
Yeah, and social work lingo, I think too. We talk about the wicked community problems that are happening, and that we are on the front lines to address them.
Yeah, thank you. Well, Lisa.
Yeah, I think that one of the things that we are doing that's innovative, that's the word that Leah started to use, so I'll keep it going, is making sure we're reaching people where they're at. And I think that is highlighted with the program that Leah's talking about, corresponding with the police and making sure that people are getting services at that moment, but also, reaching people where they're at with the Syringe Service Alliance of the Nashua area, which is a syringe service, so that they know that whether they are using or whether they're not using, they're still a valued member of our community and we care about them. Whether we're reaching people in homeless encampments, to make sure that you're unhoused or you're housed, you're a valued member of our community and we care about you and your health. To reaching people in the schools, making sure that they have, we collaborate with the regional, coalitions to make sure that they have what they need. We collaborate and reach people in their community. We collaborate with not just the Nashua PD, but with like Merrimack PD. We're working with them on their ACERT program. We're working with Milford to make sure that they have their ACERT program going and they're having all the resources that they need. And we're working with the Pelham PD to make sure that their coalition keeps growing and expanding, and making sure that they're offering like education that is accessible to family members in their community. So wherever we can reach people, that's where we're at. Whether it's at the libraries, we've gone to libraries to read to kids. We've gone to community events where we work collaboratively with youth serving agencies, especially in the summer where kids are not connected to schools, to make sure that they have projects or something to keep them busy. So we do our Photo Voice project in the summer. We already started working with our 21st Century Power Scholars summer program and are reaching out to other agencies to make sure that continues to happen. So wherever we can reach people, that's where we'll be to make sure
Yeah.
that we are connected to our community in an innovative way.
Well, and I love the way that you talked about relationships. You know, I mean, again, relationships is the core. We want to make sure we're spending as much time with community members as we are in meetings. You know, I think a lot of the times we spend, 90% of our jobs talking about what to do and maybe 10% actually doing what we need to do. And so I'd love to see, that become more of a 50-50. And I think that we do that great here at Public Health. And that's something that definitely comes from our leadership is who are the people we're working with? They're more than a diagnosis. They're more than a situation. What are their individual names? What are their individual needs? And I think that is something that is definitely a value within our organization.
Well, I'm glad you pointed it out, because what I was hearing was that you are out in the community actively engaging in all of these different projects and approaches that you're doing, as opposed to, definitely there's that being in front of the computer aspect of a lot of, a lot of roles, right? Is thinking about the problems and sharing the resources and the information, but you're really out. I actually think I called this session Boots on the Ground, because you're out really interacting with community members and there. And Lisa, it sounds like you're continuing sort of that, how you got involved in prevention from the beginning, of organizing things to keep people busy, because we know that for young people, for all of us, that human, like being connected with other people, having opportunities to practice and learn new skills that make us feel like we're valued and we can do and we can accomplish, right? Like the photo voice, like how empowering is that for those young people?
Well, yeah, I like that we're starting conversations about mental health early.
Yeah.
And it should be as common as brushing your teeth. Go ahead, Lisa.
Yeah. No, I was going to say yes to everything you said. And it's both and, right? It's both working and strategizing on those big ideas. And it's also going into the community and working with the community members. It's both.
Yeah.
You can't have one without the other.
Right. Right. And you mentioned ACERT. And just for our listeners, can you share what ACERT is?
Is Adverse Childhood Experience Response Team. So right now in our public health region, we have an active ACERT team in Milford, New Hampshire, and we have an active one in Merrimack, New Hampshire, and we're working on trying to create Greater Nashua Public Health Region ACERT response. It might look different in different communities because we all have different resources and different people to connect to. But it's something that we think is valuable, and it's a way to build resilience within our communities. So we're just trying to make sure that we are using all our resources as effectively as possible to reach as many people as possible within our public health region.
Okay. So Adverse Childhood Experience Resource Team. Response team. A little more on that. What does that look like and why?
So what that looks like in communities like Milford and Merrimack, which are the active ones, is that whenever there's a police interaction where there's a child present, because of the trauma that can cause that child, we want to wrap around services around that child to mitigate some of the adversities that we see have lifelong effects on children. So we want to make sure to mitigate some of that so that they can, know that there's people in the community that care about them, that they're seen, that they're valued, and that this doesn't have to be a catalyst for negative things in the future. It could be a way of them, connecting to resources that take them in a positive direction as well.
Okay, that's wonderful. That makes me think of something, Leah, that I think you're involved in, that may be connected or related in some way, but you're involved in a camp for young people.
Yep. So for the last 7 years, I've been the clinical director for a camp called Camp Mariposa. Camp Mariposa is a national organization that is overseen. They're out of Philadelphia. It was started by a person named Brian Moyer, who was a baseball player, because he saw that there were a lot of kids that were losing parents or didn't have a parent in their life because of substance misuse. And so we have a camp. It's run out of the Boys and Girls Club of Greater Nashua. The youth are from ages 8 to 18, and all of them that come to the camp have been impacted by familial substance misuse. So we have had kids who have lost moms to substance misuse overdose. We've had children that are living with grandparents because their parents are not in their lives for different reasons. And we have been able, because it's been so long we've had the program, see kids start out as campers, then they have an opportunity to become counselors in training, and now they're staff. And so we go once a month out to a camp, and 1 month it's for kids 8 to 13, and the other month it's for the teens 13 to 18. And the 13 to 18-year-olds, if they're good campers and, again, leaders in prevention, they can be counselors in trainings and essentially go to both of the camps. And it's a great opportunity for them to gain leadership skills and to see, a lot of the times they might feel like the odd one out because they're the only ones not doing substances. They're hearing it, they're seeing it. And for them to go to a camp where they're hearing about all the benefits of not using substances and also seeing other kids committed to their sobriety and abstinence and breaking these cycles, it's really, really important. And so, we know that these are kids that have those adverse childhood experiences. We know these are kids that genetically may be more susceptible to substance misuse. And so we want to provide psychoeducation as well as strategies and skills that they can use, because what do you say when you're faced with peer pressure? What do you say when you're faced with, a situation that you don't know how to resolve that conflict because maybe you weren't able to see those things growing up? And so really we use a evidence-based curriculum called Too Good for Drugs. So there's a clinical activity every camp, but then we also will do another more fun activity that also incorporates mental health. And so it's really looking at, again, breaking those cycles and introducing kids to the concept of mental health and the importance of talking about it. Just being able to talk about it and know that it's okay to say, I'm feeling sad, I'm feeling worried, I'm feeling disappointed, and that people aren't going to make fun of you for having those feelings, and it's welcomed, and gaining some maybe skills that they can apply in other places. It's a safe place. A lot of these kids have known each other for a long time, so they might feel safe to take risks, and where they may not feel safe to take risks in other situations. So when they feel confident and we build that industry, then they can, take it to other places.
Is it open? It sounds like a wonderful opportunity for young people. Is it open? How does a young person get connected with that camp?
So we don't have any residency requirement. The only requirement is that you've been impacted by substance misuse in your family. We do go out west, so it's in Greenfield, New Hampshire. We leave from Fridays at the Boys and Girls Club in Nashua. There's a bus that will take kids out there, and the bus brings them back on Sundays at 1. And so anybody can go if they can either get to Greenfield or they can get to the Boys and Girls Club, and then we will transport them. So they can call the Boys and Girls Club or go to their website. I think it's bgcn.com. Mike Curtin is the director. They can ask for him. If you go under alunanetwork.org, there'll also be information there. And we're also always looking for mentors. So, college students, adults, if, you've got a little extra time, we really need these kids. We know that having a safe, supportive adult in their life is 100% one of the things that makes kids overcome resiliency. Or to be resilient to overcome adversity. And so if that sounds something someone's interested in, we're always looking for mentors, and we only ask that you come to 4 camps a year. So
Okay, great, thank you. And I think that Nikki's been able to put those links in the chat, so thank you very much. Well, thanks for sharing what you guys do and how you got involved in it, and what you're doing on a daily basis. I really appreciate it. A lot of your work, I think, at this city level, you're involved in big projects, that take, Lisa, you were talking about collaboration, right? Bringing everyone together, working on these, pretty big efforts. I'm wondering if you have anything you'd like to say to the listener, the everyday, listener who is wondering, I care about people. I care about my family members, care about myself, and the community members that I have. What are some things, what's something I can do in my individual role, right? That I'm not in a position where I'm in these different teams working together, but what can I do on a daily basis um, to support my community members' mental health and prevent substance misuse?
I think self-care, I think, is really important. I think Leah alluded to the fact that she, was off and was, refilling her cup so she can come back 100%. And I think as a society, we don't prioritize that, and we think it's selfish to take care of ourselves. But in reality, we can't take care of others if we're not 100% and we're not taking care of ourselves. So I think that's one of the things that everyone can do, is start to prioritize their mental health and their physical health, so that they can give the best of themselves to others. And then two, asking people if they're okay. It's like, how are you feeling? How's your day going? Like, just making conversations with people. I know that one of the things that when I first started working here, I thought was weird, was that our director said good morning and hi to everyone on the street when we walk by. And now I feel like it's contagious. And now I'm saying hi and good morning to everybody in the street, regardless if I know them or not, because you never know when like a smile or a good morning will make someone's day because they're being seen, right? So those are little things that you can do. And then if people are talking to you, not minimizing their sadness or, their feelings, making sure that we are able to, just, I understand what you're saying, or I hear what you're saying, and making sure that you are not minimizing their feelings, and referring people like to resources like 988 is a great resource if someone is struggling, or just for ourselves asking for help. I think that many people feel like, I can't ask for help, it'll make me seem weak or something like that, but I think it's brave to ask for help, and it takes a guts to ask for help. So I think that more people are able to do that and know that help is available. There are so many like helpers in New Hampshire that just want to help, whether you call 988, whether you stop by your police station, people want to help, whether you stop at the fire station, whether you're talking to your teacher, coworkers, people care about you, and no matter who you are and what you're doing or what's going on in your life, I want everyone to know that you are enough, just the way you are. So those are things that I think are super important for us to be able to take care of ourselves and also help others. And the last thing is talk about mental health, right? Like, don't be scared to talk about mental health. With everybody. Let's stop the stigma around mental health and just talk about it. We all have mental health, just like we all have physical health, and we can all work towards mental wellness. But it's not going to happen if we think it's a taboo and we can't talk about it. So talk about it with your kids, talk about it with your neighbor, talk about it with your family members, your friends. Just talk about mental health as much as possible, because that's how we find out if people are feeling great or not feeling great, and how we can help people. So I think those are things that everybody and anybody can do. Um, you don't need a degree to ask someone how they're doing, or asking for help. So
Thank
yeah.
you.
And I think it's okay to set boundaries. We lead by example, not authority sometimes. And so, like, for example, I was on vacation last week and I definitely checked my email, but I really told myself, you don't need to respond. You're on vacation. You can let this go. Because if I feel the need to respond to every email and now somebody else goes on vacation and they're like, well, I have to check my email because Leah responded to all her emails when she was on vacation, instead of being like, you know what? Leah didn't respond to anybody and she's a therapist. She knows. You're like, I'm not responding either, because sometimes we need permission to take a break. We feel like, it's such a, especially what we do, we give up a lot of ourselves for other people. We're obviously people pleasers, givers. And sometimes we have to say, no, I can take for myself, and that's okay. And other people are not going to see it as a problem. And, and if you do it, then maybe somebody else will be more comfortable to do it, because maybe I have more power than somebody, I'm privileged, and I am a white woman. And so somebody else might feel as though they can't take a break because they're a different ethnicity and it might, be seen badly. And so by knowing, that it's okay to just show that for other people too.
Yeah, that self-care piece I think is so critical, and it's hard to find that time and give yourself that permission when things that can literally be piling up, and you start feeling that, and to take that step back and prioritize yourself. And on a day like today, that hopefully today, right? Because it's so beautiful out, getting outside to smell those lilacs and take a little sun, take in a little sun. Hopefully everyone can spend a little time on themselves today. Well, I appreciate you all. Thank you for everything you do. Thanks for sharing what you do. I think it's so inspiring, to see all the different creative, innovative efforts, collaborative efforts that are happening in Nashua. I think that's an example. I know it's happening in a lot of communities around the state where people are working together and celebrating people, right, and their communities, and lifting them up, and making sure they're seen, and giving them voices. And I thank you for all that you do.
Thank you.
Thank you.
And listen to their podcast. It's awesome. I don't know if we put it on there, but we will afterwards. But thank you so much. We'll see you at another Zoom meeting somewhere, I'm sure.
Definitely.
Thanks.
Thank you for inviting us.
Thank you.
Thank you.